All this term we've been highlighting the research being carried out into this increasingly common disease by experts at the University of Warwick. The university currently has more than 80 researchers working on diabetes, both at the medical school on campus and here at the University Hospital of Coventry and Warwickshire. Prominent among them is Professor Sudesh Kumar, who's been telling me about his research into the links between obesity and diabetes.
We know that being overweight confers a risk in terms of developing diabetes, and most of my research is focused on trying to understand what causes that excess risk. And to do this work, what we have to do is to carefully characterize people in health before they have diabetes and then people with diabetes. So for instance, we will bring them into a clinical research facility. We will measure them in every way, because different bits of fat are different. Fat around the belly is worse for you than fat around the hip. And then we measure the amount of fat on a machine. And then we take blood samples and samples of fat, sometimes muscles and so on. And then they're brought into a lab where a team of scientists would work on it. So my research is very much multidisciplinary. We have clinicians and scientists working together to understand this.
Now, you're hoping this research will lead to an effective diagnostic test for diabetes.
I'm pleased to say that we've already come up with a patent for a possible new diagnostic test. One challenge, as you know, obesity is very common, and the big challenge for a GP is knowing which one of his many thousands of patients are at risk of getting diabetes. And we are hoping that this will be the basis for a test the doctor can do in a surgery fairly rapidly when you go and see them. And because at the moment they can tell if you've got a family history of diabetes, you're probably at slightly higher risk. If you're overweight, you're at high risk, but that's still not good enough. There's still a huge number of people involved, and we want to try those to find those who are at highest risk.
Treatment of diabetes hasn't moved on very much over the last 50 years. How are you hoping your research will help?
You're right. I think our treatments are evolving, and we need to do a lot more, because as you know, there's an epidemic of diabetes. A lot of people with it. We need better treatments. And one area I would say that our work is focused on is inflammation. If we can develop newer therapies, and that's what we're working on, that to target inflammation, then it will help to further reduce diabetes in those at risk. However, all this is not solved in the lab alone. You clearly need to do work on exercise and healthy eating habits as well.
We've looked into diabetes in some detail this term. Some have warned of an epidemic of diabetes. Are you optimistic about the future?
That's a very profound question. I think we have about 1.8 million people with diabetes today. We project that will increase to about 3 million. And the big question for us is, in a publicly funded healthcare, can we really afford to treat so many people? Because even one single treatment or one test could break the health economy when you have to apply it to this level of people. So equally, I think we have to work on prevention of diabetes. And I'm pleased to say that most of our program is about prevention. And this will have to be complemented by work on healthier eating habits, more exercise, and so on. One good example is Finland. They set out to do that 25 years ago, and they have dramatically reduced number of people who develop heart disease and diabetes. So that's what I'm hoping. So I would be cautiously optimistic. I think it's a tremendous challenge, and but if you make the right policy decisions at the government level as well, we have a chance of containing that epidemic.